How does LEEP affect fertility and future pregnancy? Imagine a procedure that helps prevent cervical cancer by removing abnormal cells from the cervix. That's what the Loop Electrosurgical Excision Procedure, or LEEP, does. Many women worry about how it might affect their ability to have children later on. The good news is that current research shows LEEP generally does not impair fertility. Studies comparing women who have had LEEP with those who haven't show no significant difference in their chances of conceiving or having children. So, in most cases, LEEP itself isn't a cause of infertility. However, while fertility remains intact, there are some important considerations for pregnancy after LEEP. Because the procedure involves removing tissue from the cervix, it can sometimes weaken the cervix's structure. This may lead to a higher chance of certain pregnancy complications. For example, women who have had LEEP are at a slightly increased risk of delivering prematurely, especially if a large amount of cervical tissue was removed. The risk of early rupture of membranes, where the amniotic sac breaks too soon, can also be higher. Additionally, there's a small chance of giving birth to a low birth weight baby. It's worth noting that recent studies suggest that, if the tissue removal during LEEP is carefully controlled and minimal, the risks of preterm birth or miscarriage can be reduced. The key is preserving as much healthy cervical tissue as possible. The cervix plays a vital role in pregnancy by staying closed until labor begins. When tissue is removed, it can sometimes weaken this function, leading to what's called cervical insufficiency, which can contribute to early labor or other issues. Some women might notice pain during sex after LEEP, which can influence their reproductive health or comfort, though this isn't directly linked to fertility itself. If you've had LEEP and are planning pregnancy, it's important to tell your healthcare provider. They can monitor your pregnancy more closely and intervene early if needed. Regular prenatal visits and early management can help reduce potential risks. Deciding to perform LEEP involves balancing the need to remove precancerous cells with the potential impact on future pregnancies. It's usually recommended only when screening tests indicate abnormal cells that need treatment. Overall, most women who have had LEEP can conceive and carry pregnancies to term without major issues. Still, individual factors vary, so talking openly with your doctor about your reproductive plans is essential. Remember, each person's situation is unique, and personalized care can make a big difference.